Next Generation NCLEX 国際看護師のさけみです。日本時間毎週土曜日夜7時投稿、おばさん頑張ってるので、皆さん Spread the word お願いいたします。さて、海外で看護師をすると、Bedside Shift Report はね、絶対に避けられません。でもみんなどうしたらかわかる？患者さんの安全確認はもちろん、チームの連携が良くなったり、患者さんやご家族も会話に参加できて安心感が増すっていう素晴らしいメリットがあるからなんです。なんて綺麗事を言ったけれども、現実はね、もう全然甘くないから。もうね、癖が強すぎるアクセントのナースのレポートにね、ちょっと待って、今なんて言ったのって白目をね向きそうになったりとか、逆に私の英語に対してはぁ、何この人何言ってんのわかんないみたいなリアクションをねされて心が折れそうになるなんてね、もうこんなの日常茶飯事。私もまだ苦労してます。だからこそみんなね、渡航前の練習の段階でたっぷり苦労しておいてほしいんですよね。実際現場に立った時にね、あの時ナースあきみの動画で必死に練習しておいて本当に良かったと思えるようになってほしいので動画を作っています。じゃあみんな一緒にリスニング攻略していきましょうね。
Jonah said, "Hi, David. I brought in day shift nurse Akemi. We are going to do our bedside shift report that is our mandatory protocol. It seems that you are resting quietly. Would you like us to do this outside the room?" David said, "You can do it here." Jonah said, "Thank you, David. You can join in any time with your concerns or questions, okay?" David. Jonah said, "This is David. He is 71-year-old male. He came to our med-surg floor around 5 p.m. yesterday from the ICU. He was admitted on October 28th from his assisted living facility. It means 3 days ago. Allergies are negative, full code. Medical diagnosis is chronic cranial subdural hematoma. He came to the ER because he was having a sudden severe headache. Once he came to our ER, he had an emergency procedure. It's called burr holes for evacuation hematoma by our neurosurgery team. He had a JP drain on the left side of his head, but it was discontinued prior to arriving on our floor. There is a clean, dry dressing on it. Because his medical diagnosis is chronic instead of acute, so let me go back his story in July. He had a VP shunt placement in the ER because of worsening headaches. His MRI showed enlarged ventricles. The patient underwent high-volume lumbar puncture and improved his confusion as well as his balance. Okay, let me start my eye-shaped. His medical histories are normal pressure, hydrocephalus, depression, thymoma, dementia-like symptoms, hypertension, frequent falls, hyperlipidemia, and more. The attending doctor is Dr. Adams, consul to our neurosurgery and PT/OT. Alert and oriented by 2 or by 3, his answer of placement and date are sometimes accurate, sometimes inaccurate. Room air, no telemetry order, diet MPO, but I will be back to this diet episode in a bit. No AccuCheck. He has 2 IVs. One is in his right forearm, other one is in his left forearm. Both saline lock, flush good, no blood return notice. You really need bed alarm for this gentleman. When he stands up, he moves so quickly. There is an order that we have to clean cranial incision site daily. So, I want to go back to the episode of diet. I gave some medication around 4 a.m. He was able to swallow 2 tabs at 9 p.m. However, he could not swallow the same medication at 4 a.m. and started terribly coughing as well as forceful gagging and choking. So, I placed a consult to the speech therapist, and charge nurse talked to Dr. Adams on behalf of me around 6 a.m. His diet was general diet earlier, but now MPO until speech therapist evaluation is done. Jonah turns his body from Akemi to David, and he has a good eye contact with David. Do you have any questions, David? David says, No, I want to go to bed. Let me sleep. Akemi says, Okay, let me write down my information on the whiteboard. My name is Akemi. My number is 333 tonight. You can get a hold of me by using a call light or telephone on the table. I will finish other patient reports and will come to assess you. Anything that I can do for you before heading out? David. No answer. Akemi. Okay. See you soon. Jonah said, David, I don't come back to work tonight, so good luck for your recovery and thank you for allowing me to take care of you.
一つ訂正します。ごめんなさい。スライド6ページ目、Hyperlipidemia が正しいです。ごめんなさい。次男坊がテープしている間、私席外してって、その後すぐに次男坊のジョナ、仕事に行っちゃったんです。で、住んでる場所が違うので、テープを出さなくちゃいけない日になってしまったので出します。でも本当ごめんなさいね。Hyperlipidemia が正しいです。Hyper 高い、Lipid 脂肪、Emia 血管内です。じゃあ以上です。ごめんください。